In my humble opinion, this is TikTok nurses all over again. How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about more than 75 doctors at a South Florida hospital who have walked out in protest over all the unvaccinated coming in there and taking up all the ICU space, allegedly. They covered this on MSNBC, and we'll get to that in a moment. But they said at least 85% of Florida ICUs are full. Now, they're not saying who they're full with. They want to talk about all the unvaccinated coming in there and that being the problem, but they're not saying all the ICU beds are filled with unvaccinated people suffering and or dying from the virus. They're also not saying exactly how many ICU beds there are. Have you ever been to an ICU before? I have. It's 8, 9, 10 beds in there. They're making it seem like there's 1 million beds in there and every hospital is just filled to the top with people in every one of these 1 million beds. Is it that way? I don't think so. But before I go any further, let's roll the clip. In this clip, you'll see and hear what the doctors are talking about. You'll hear their grievance. You'll hear why they're upset. After we get done watching that, I'll come back. I'll talk about what was said there. Then I'll give you my 2 cents, my deep detail analysis, and then I'll wrap it on up with a nice bow on top. So without further ado, let's go ahead and roll it.
This is why.
Just moments ago, more than 75 doctors staged a walkout to protest the number of COVID patients coming to the hospitals who have not been vaccinated. The thing, let's bring in Carrie Sanders, because Carrie, you're in Palm Beach Gardens, Florida, at this doctor's walkout. Carrie, and I know the area very well. What Americans don't understand is for every unvaccinated person that's filling up an ICU bed, that means with the hospitals jammed, somebody with a heart attack, and I've known somebody in this position, goes there, has trouble getting in, can't get treatment, can't get a bed. It is a nightmare for the doctors. It is a nightmare for the nurses. And to the doctor's point of view, it's worse yet for sick people that want help from them.
That is truly reflective of the frustration that you see behind me. And these doctors have gathered, some coming off their shifts to come out here, gathering to try to tell people, please, first of all, ignore the nonsense and the absurdities that you're hearing people say at public meetings and recognize the value of what a vaccine will do. 85% of the ICU beds in Florida are full. Now, there are some hospitals that have no space in the ICU. They've turned cafeterias, they've turned conference centers over to beds to house patients because they are so overwhelmed. Dr. J.T. Snarsky is joining us here. She's one of the doctors. First of all, you hear that woman at the school board saying the absurdity. How does that make you feel, and how do you combat it?
It's incredibly frustrating because we know vaccines are safe and effective, and it's people who go out and talk against them that really go against physicians and medicine and science, and it's not the message we want to get across to people. Vaccines are safe, and we need to get our communities vaccinated.
It is significant. As I step out here, I can see they're all standing here, white jackets, some coming off of their shifts.
All right, so you saw that, you heard that. Now, there's quite a few things that we can talk about. But I guess first things first would be, did you see the actual footage, especially toward the middle and end where they had that wide shot and the one lady in the black coat was talking? Now, you had all the doctors behind her with their mask on, right? Were they distanced? No, but I guess we're not doing that anymore. I guess it depends upon it depends on who you are, whether you distance or not. But anyway, they all had their mask on except for the two that were speaking. So if the two that are speaking and spewing out all types of spit and particles and cooties and everything else, if they're not wearing their mask, then what's the purpose in anyone else behind them wearing their mask? It's political theater. And also 75 doctors at one hospital. Now, do they all work in this one hospital, or are they from different hospitals? I don't know a lot about hospitals and how they operate and how many doctors are at each one, but you're probably not going to have 75 medical doctors at one location. Maybe nurses and doctors, like the whole staff combined, but 75 medical doctors And what kind of doctors are they? Are they primary care physicians? Are they cardiologists? Or what do they really do? Who are they really? Where are they coming from? Are they all even from Florida? Is it a political thing to show a message, or did they actually walk out of their duties at this one hospital? And again, just because they're saying there are a lot of unvaccinated people in the ICU does not mean the ICU was filled with only unvaccinated people, right? Because at a certain point, you can go to the ICU for a variety of reasons. Maybe you weigh 1,000 pounds and you having multiple strokes and heart attacks and things of that nature, and you may go to the ICU. Okay, maybe you are a crackhead or a heroin addict and you're in the ICU. Maybe the ambulance came to where you live, had to revive you with Narcan, then they brought you to the hospital. Maybe you're an alcoholic and they had to put you in there, get you on fluids to get yourself back right. Okay, who's actually in the hospital? Gang bangers, people getting shot out there in the street, no insurance. Who's in the hospital? And also, there are ways to prevent going to the ICU, yes. I mean, it's not just one thing you can get sick from or go to the hospital and have problems from. It's not just the virus. You also have, like I said, people that are gang banging, shooting and killing each other over $20, a pair of Jordans, some 900-pound young lady with 45 kids by 11 different dudes. You getting shot and killed over that, or shot and injured over that. So the doctor could say, you know what, I don't want to treat you because you keep coming in here, you keep getting shot, you keep doing the wrong thing, you're not making the right decisions. I'm not going to treat you. I'm going to walk out. If you overeat excessively, I'm not going to treat you. We told you what to eat. You didn't do it. Here you are. Yeah, they get in the hospital. I'm not going to treat you. Oh, you want to, smoke crack all day? You want to shoot heroin and fentanyl and stuff like that? You know what? That's drug addiction. That's your choice, not mine. There are clinics available to you. There's rehab facilities. You got the DARE program, Just Say No. Because all those things exist, I'm not going to do my job as a doctor. I won't fulfill my Hippocratic oath, do no harm. I won't do my job because you're not doing your job. How does that make any sense? I'm not going to say the majority of the time, but if not the majority of the time, near the majority of the time, people are in the hospital for preventable things. Preventable things. And yet they get treated regardless. Even if they have no insurance, with no real way to pay for whatever they got going on, they're going to get treated. If somebody comes in there who they've been shot about 4 or 5 times and they bleeding, and they have no insurance, they have no means of paying. You even got people that are in custody of the police that are in the hospital. Like they're locked up in the hospital. You know that they committed a crime, although they may not have been proven guilty yet. It was on body camera. Everybody saw it. It was a bunch of witnesses. You could be a person who gets shot. Like here's an example of how absurd this whole thing is. You could be a gangbanger, an aggressive gangbanger, going out there and shooting people for no reason. You could rob an innocent person. You can shoot them, try to kill them. They shoot you back. The person, the victim is in the hospital, and then the shooter goes to the very same hospital, and they both get treated on by the same doctors. There's no, well, you're the shooter, you're a gangbanger. Nah, they do their job. So why would it be anything different here? It's a political message. It's all about trying to get Ron DeSantis out of there. Politics are very dirty. People ask me all the time, hey, ABL, do you want to get in politics? When are you going to run? I mean, if I had to later in my life, I think I would. But that's not really a thing that people really want to do. It's dirty. It's contradictory. It's kind of fake. And things like this happen all the time. All these publicity stunts, they happen all the time to try and scare people, manipulate people, to try and damage politicians. And I'll say one last thing as I close. They're trying to damage Ron DeSantis, they're trying to damage the reputation of Florida, yet all the New Yorkers are not going anywhere. All the people from D.C. that couldn't make it up there, or it just got too weird, from all over the country, they're going to Florida because it's a successful state. It's open. You can have freedom there. Everybody's on the way to Florida. They're not on the way to California en masse or Chicago, Illinois, New York, New York. They're not on the way there. These places are losing people. And it's not hard to tell why. Who wants to live in a place where it's ridiculously expensive, zero freedom? Why would you want to be there? Why? For what purpose would you want to be in a place like that? You want to go to Florida, but getting back to the politics, they want to damage Florida, damage Ron DeSantis. It's not really working because the planes and the trains and the buses and the vehicles are not slowing. They're just increasing day by day. And I think when the average normie sees what's going on and how corrupt and politically biased the news stations are, how politically biased some of these doctors and these stunts are, they're going to say, you know what? Okay, I'm done. I'm not going to pay that any mind anymore. I'll just believe myself in what I think. And what I think is that all this hubbub about Florida being some type of just, terrible place is not true. But I think I'll leave that right there for now. And what say you? How do you feel about the doctors walking out because they're in protest of all the unvaccinated that are coming into the hospital and flooding up the ICU? Whatever your thoughts on that are, let me know in the comments below. You guys know where I stand. This is a ridiculous publicity stunt, politically driven, trying to attack Florida. And I don't think it's going to work. People that really believe in the shot and they want to get it, they're going to feel the same way they feel. And those who don't want to get it, they're going to feel the same way they feel. Okay? Let everybody live their life. People can still go out here, get drunk, crash their car, almost die, go to the ICU, and it's fine. Anybody trying to say, oh, well, you were drinking and driving, you don't deserve to get treated. I mean, think about that line of reasoning, because it makes sense to say you shouldn't have been drinking and driving. You shouldn't have been shooting heroin. You shouldn't have been gang banging. But guess what? They still get treated all the same by these very same doctors. So until they want to walk out for those reasons, I don't want to hear another word out of them. But whatever your thoughts are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.